All right, thanks everyone for joining us for the second webinar of a four-part series. Tonight our topic is consumerization of healthcare, and we're going to be exploring some important trends affecting the dental profession and what that means to you folks as future practitioners. Sponsored by Aspen Dental, this series on the evolving business of dentistry is offered expressly for you as members of the Next EDS user community. I'm Rich Groves, and with me this evening is our speaker, Dr. Jere Gillan. He's the practice owner of practices, multiple practices, folks, in Florida, and he'll provide a little insight into how that came to pass in just a few moments. A few housekeeping rules beforehand. Dr. Gillan, just to give you some context, is a University of Florida College of Dentistry graduate, has an interesting track once he entered practice, and he's going to explain in some detail. He currently lives in Orlando, and there's a whole bunch of kids that are waiting for him at the other end of this webinar tonight. We're going to talk for about 45 minutes or so, and if you wouldn't mind, if you have any questions over the course of the dialogue, please feel free to use the chat window or the Q&A, and as we get underway, we'll have a chance for Dr. Gillan to address them all at the last 15 minutes or so of the presentation. So please feel free to, at this point, turn your attention to Dr. Gillan, and we'll look forward to covering those questions in just a little bit. So without any further business to handle, let's begin. Dr. Gillan.
Well, thank you very much, Rich. It's an honor to be speaking to all these nice folks tonight. I just want to say thank you for all the efforts that you guys have put into this webinar. You've been a great company and corporation to work with, tremendous organization, and I really appreciate you being able to give me this opportunity and make something of this. The great topic that we're about to talk about, folks, and I see it every day. I live it every day. I am in I work for a dental service organization. I'm going to click through the biography here for just a second. I do, and it's an honor again to speak with you guys. I do remember about 5 years ago, I was maybe in some of your positions as a senior dental student ready to graduate, and wondering what the heck was going to happen, when I got out of dental school. I also, at that time, wondered why there were so many companies coming to the dental school, taking us out to dinner or having lunch and learns, and I'm going to use air quotes here. They were corporate dentistry, and it seemed like they were the ones really going after the dental students, and they piqued my interest, and I listened, and I wanted to see what was going on. But I think as a lot of us at this point are trying to figure out, maybe private practice is the place that we thought we would want to go. It certainly was for me at that time. So when I saw a lunch and learn about a dental service organization, there were a lot of great things that they had talked about, and so as the time went by, I tried to find positions in a private practice, if you will, maybe like a cosmetic type of place. And for me personally, I just found they weren't out there in a full-time type of capacity. So there were many things that drew me to dental service organizations or corporate dentistry, and we'll share with those later, kind of what they were and what the benefits were for me. As you can see, I was in the Air Force for a long time. I graduated in 2011 from University of Florida, and I started Aspen Dental right away. And just 6 months later, I became a practice owner of my first practice. About 2 years later, I was able to purchase 2 more, and just last September, I purchased my 4th office, mostly here in the Orlando, Florida area, for those of you that are familiar. And it's been just an amazing experience. I've taken care of thousands and thousands of patients. I've got 3 great doctors that work with me in 3 of the other offices. I pilot one of them myself, and we have a great team, top to bottom, dental assistant to lab tech, and I feel very honored and lucky at times to have these wonderful people to work with. Kind of click through here. So again, what we're talking about tonight is, not really a sales pitch for corporate dentistry, so to speak, or a dental service organization, but we're really talking about consumerization of the healthcare market. There are trends happening out there in the business world, and especially to do with healthcare, things that are a lot different than maybe things were about 20 years ago, 15 years ago. We're in the middle of a paradigm shift. I'm fairly certain. I think I know because I see it every day, where traditional practice models just aren't living up to the standards that patients or consumers these days want. Okay. Sorry, there we go, okay. So the objective tonight, we're going to obviously explore the behaviors of today's healthcare consumers. We're going to discuss at length responses of the healthcare systems to the expectations, and then definitely get to talk about how dental service organizations, or DSOs, have kind of addressed those consumer needs and consumer wants. There we go. Okay, so as a dentist, we are first and foremost caregivers. We all know that. I don't think anybody gets into this business just to make money. I think patients are our primary concern for all of us. We want the best for our patients. We want to take care of people. If you're not in this business for that reason, you should look for another job, I think. But as time goes by, patient care is definitely, like I said, primary. But there are businesses to run. There are people to manage. There are, business points to kind of consider. So we're in a free market, as a lot of folks know, and then and what happens is patients end up voting with their feet. What that means, in essence, is that they go where they feel the most convenient, and they feel that whatever's happening is exactly what they want when they want it. Go next slide. So our patients, like ourselves, kind of have the same goals that we do. We have expectations about healthcare. They have expectations about healthcare. And if we feel that something's not being met in our personal lives or wherever we're going, more than likely we're apt to change where we're going to get that healthcare. It's the same for our patients or our consumers. Oh, let's go back one. I'm sorry about that. Okay, so before we get too much further, just want you guys to ask yourselves, how many of you have visited an urgent care clinic recently, and especially as opposed to going to an emergency room? You're not alone. 3 million people in the U.S. visited an urgent care clinic last year. Why do they do that? Why an urgent care versus the emergency room? Well, if you've been to the emergency room, more than likely you know it's a minimum of 5 hours to be there. It's very expensive to be there. You're going to get, depending on what the problem is, you may get treated there or triage. It may just send you home, but again, it's a long time to spend to see somebody to kind of take care of something, and we all know that, especially if you're having some kind of pain. So let me ask you this too: how many people receive flu shots each year? How many will go to their primary care physician to get that flu shot? Probably not many, and certainly not a lot of consumers that are out there right now. Pharmacies have opened up, Walgreens or CVS, where you can just go in and quickly, I think in 10 minutes, get a flu shot. Sometimes it's for free. So it makes it very convenient, and those pharmacy hours, they're open, 10, 12, maybe 14 hours a day sometimes. So that's kind of what we're going to be discussing this evening. In this next slide, I love this quote because I think it's pretty appropriate. We expect to do our banking 24 hours a day, 7 days a week. We want to shop 24 hours a day, 7 days a week. And now we want healthcare to be available to us the same amount of time. People like to go online. People like to make appointments that way. Life is tough, and whenever you have time to do something that needs to take care of yourself, you're going to find time. But sometimes we just can't get to do it during the day because we have other responsibilities to take care of. Okay, so we got the traditional practice model, which again, a lot of folks, they get into dental school and they think this is what's going to happen. They're going to graduate, they're going to get their degree, they're going to maybe go out, find a little place to open up, build it out, put some dental chairs in there, hang up their shingle, and then that's it. Then they're going to be making hundreds of thousands of dollars a year for the rest of their life, and they're going to be very happy. They're going to work 4 days a week, maybe 3.5 for staffing or whatever, and life's going to be great, right? Maybe. I can't say that this won't happen to anybody because you know, nothing is for certain. But what we do know is that patients these days, when you look at the traditional practice model, especially when you look at these areas which is, you know, 9 to 5, Monday through Friday, that's if you're lucky in a private practice. No after-hour support. They don't take walk-ins. They don't take emergencies sometimes. Some aren't even accepting new patients. Obviously, it makes it a little bit difficult for people that need care to get care, and that's the most important thing. We are in the business to get people care and the care that they need, with hopefully some sense of urgency. So what's happening is we have the emerging practice model, which again we're going to talk a little bit more about dental service organizations. But just like the urgent cares, they're available. They have flexible hours. They, you know, sometimes they're open until 9 o'clock at night. Sometimes they open at 7 o'clock in the morning, like I do 3 days a week. And what we find is that when you expand your hours like that, you're really, the net is cast a lot wider than if you're just open, you know, 4 days a week from 9 to 5. And what you'll find is if the net is cast wider, usually you get a lot more diversity of patients and procedures and needs, and I can't tell you how, you know, appreciative patients can be when it's New Year's Eve and they're walking in because something happened in their mouth and you're the only guy in town that's been open. They hug you, literally they do. And so here we go again, you know, the patients vote with their feet. So what do they want? What do our patients want? And what I love about this slide here is that, you know, while these guys I think are at a gaming convention, like doing some kind of, you know, competition or something like that, what I love is that everybody's connected to something, especially in their hands, because God knows we all have, you know, smartphones, and they want convenience. They want online access. They want to make their appointments online. They don't want to wait for anything, and obviously they want quality care. And that's what the dental service model is really trying to accomplish, is try to make it convenient for people that need help to get it. And again, with you know, websites and online booking, and you choose your time you want to come in. Oh, you have a problem with your mouth? Walk right in. That's not a problem. You know, this is what people want. And then I love this little question down here: do you have coffee? Because, you know, patients want everything, and then they want a little bit more too. And we'll talk a little bit more about that. Again, so how are they going to get it? They're going to probably seek out new practice models. They can compare and shop. I have a lot of folks come in and just say, listen, you know, I'm thinking about getting dentures, getting my teeth out, but you're my second of 4 appointments today. I'm just here to get an estimate. No problem. You know, we do the exam, we do the x-rays, we give them their treatment plan, and hopefully we're the one that's going to make them hopefully feel most comfortable and maybe hopefully beat out the other competitors as far as price is concerned. But I got to bring this up because this is probably becoming one of the most important aspects to drawing in new patients, and this is online reviews. During my new patient exams, I usually ask the patients, you know, how'd you hear about us? A lot of times, oh, my sister comes here, or oh, you know, you're on my insurance plan. But lately, in the past year or so, about half of the people walking in the door, or that answer the question, they go, you're convenient to my house. You're right. I can see you right on my drive to work. And I looked online, and you have the best reviews out of anybody else. So online reviews have become like a major factor in getting people through the door, and so that's what we do. We always try to give everybody the best care that they can, that we can. You know, quality care is very important to me and to my doctors. But when somebody is happy and they've said that, you know, I really enjoyed this experience, it was pain-free, or gosh, you know, I love the veneers you did for me, we'll certainly pass them an online review card, and because we know that that is a very, very strong tool and powerful tool to try to get patients, into your practice. And it doesn't matter, Yahoo reviews, Google reviews, Yelp is a big deal now. It wasn't about a year ago, but in the past 6 months, I mean, you know, you get on Yelp and you look at your app, your office, or your site, you better hope you got 5 stars, because it's effective. So one more thing, and right, okay, so, what do they want? They want you to make them feel comfortable, they want you to make them feel safe, they want a warm and fuzzy when they meet you and when they're deciding if they're going to accept treatment. And then obviously, there you go, do you have coffee? That's what I'm saying. They want it all, they want you to be the best that you can be, they want to have the best experience, and then they want coffee too. And having coffee in your waiting room is a very nice thing for patients. So what are you going to do? You're going to get to work, right? Let's think about this a little bit. You know what the consumers are expecting from you. You have to kind of be awesome, be friendly, be courteous, and also be excellent at your skills. Because as soon as one of those things fall down, they're going to take off and leave. They're going to find somebody else that's going to give them the care that they really feel that they deserve, and rightly so. If something happens, I don't expect somebody to stick around, and it's unfortunate, but it does happen sometimes. So here we go. Let's delve into the solutions explored in other healthcare professions, shall we? Like urgent cares, for instance. So what sorry, Rich, thank you. So one of the things we do know, we talk about retail or urgent cares, talk about CVS, Walgreens, you know, all these pharmacies are considered retails. Major one I know that's made a huge impact in a market is lens crafters or Pearl Vision, but lens crafters mostly. You know, their model is fantastic. Inexpensive glasses, very fast. Their hours, I think they're open 12 hours a day. You can see the doctor, I think, on Sunday. So obviously, you know, these types of places that are convenient, they're growing in numbers as far as locations. You can see here in 2007, I think compared to all the urgent cares and everything else, we're looking at just about 250. Today we have around 2,000. My company, Aspen Dental, when I started, we had, I think, 310 offices. Now we're at about 550. And I mean, it was 5 years ago, but that's a tremendous growth. But Aspen Dental is not the only one. There are other dental service organizations out there that are growing very fast, but because, again, consumers are demanding that we are, you know, providing them the care that they need when they want it and how they want it. We'll go to the next slide here. And then, you know, when you think about, okay, what kind of procedures are people getting out there? You know, you can go to a radiology clinic now. You don't have to go to the hospital to get an MRI. They have MRIs in private places, and the insurance is going to cover a good portion of it. But, you know, you don't have to go downtown and go to the hospital and wait and, oh, you know, your appointment's the wrong time, it's tomorrow, and then come back. I mean, it doesn't have to be so inconvenient. They have dialysis in clinics. They have urgent cares like we see here. Okay. So now let's look at this quote. Okay, no one expects a traditional model to become obsolete. I certainly don't. I have many friends from dental school that are in their own private office right now. Some are doing fine. I have, unfortunately, some friends from dental school that have, you know, in the 5 years, they're at their fourth office or fourth practice or fourth job, essentially. You know, but again, we know that private practice models and the traditional model is not going to go away completely. It will certainly, I feel, over the next, you know, 10 years, drastically, reduce because, again, consumers are demanding things that will become a certain way. There we go. So here we go. It just the 5 biggest reasons why consumers are choosing to go to retail clinics. As you can see, no usual source of care, cost is lower, convenient location is extremely important. But the most important thing I can tell you, especially from my experience, is that the convenient hours. You know, we do tend to work long hours in the dental service organization setting. Not that it's always a bad thing, because again, you know, at 7 o'clock at night, there may be that one person that can only make it at 7 o'clock at night, and you're the only person literally in the whole town that can get their mouth fixed. So again, it's more to it than just trying to cast the net and make a ton of money. It's about helping people, and especially those people that normally can't get the care for reasons including the ability to make it to a location. So when you add it all up, and you know that retail clinics log millions of visits annually, you know, what does that tell you? Why do they do this? Well, these are all good reasons right here. Let's go to the next slide. So the entire model of urgent care and retail healthcare facilities is based on giving consumers what they want in terms of convenience and lowering the cost. As you can see here, I talked about this earlier, the emergency room, $1,500 per visit, where urgent care, probably less than $150. You're accomplishing the same goal, you're getting fixed, whatever your problem is, and I can tell you time is a huge, huge improvement as well. So at a time when adult visits continue to decline, and what this is showing is, you know, between 2003 and 2012, adult visits to the dentist have continued to decline for a number of reasons, which we'll explore in the next webinar, the next DDS, which is important for us to be aware of the changing patient expectations and needs. Note, though, that this is not retail clinics declining, that this is just adult visits to the dentist declining. So what's the big takeaway from all this? Healthcare can be inefficient. Consumers are demanding that we eliminate these inefficiencies. They are looking for models built around their preferences instead of yours and mine as providers. I guess another way to put that is they don't care that you have a golf game on Wednesday afternoon. They don't care that you want to take a week at Christmas to be with the family. They have needs. They need to get them met. And if you're not there to meet them, they're going to find somebody else who will. One of my favorite stories is, I'm not going to mention names for HIPAA obvious reasons. Christmas Eve last year, we were open, and a lady walks in. Christmas is literally the next day. Tooth, very front tooth, number 8, broken near the gum line. It was a crown, had some decay around it, and she literally lost her front tooth on the day before Christmas. We were the only folks open that day. We brought her in. We did a root canal, a post and a core, and a crown prep, and put a temporary on, put her all back together. And I'm telling you, that lady is a patient for life. Her reason for seeing us at that point was, oh, well, my regular dentist is closed. I've heard that a million times. And when we're able to kind of be there for that person, like I said, they're going to find somebody who will. And you know, she was so happy, and it made us feel very good that we were able to be there for her to kind of fix that problem at that moment. So as a dentist, we have, you know, possible solutions, several options available to us. So what are the possible solutions? So if we're in a private practice model, I guess, you know, we can be all things to all people. Well, I can tell you right now that you can't. And this is, we're going to talk about dental service organization, what they provide to providers in just a few slides. But again, we can't be all things to all people. You'll burn out. You can't run the business at full force, and you can't see new patients all day every day, and you can't do crown and bridge all day every day. Again, it's a difficult thing. So what can you do then? Let's say you wanted to take on a partner in the traditional model. Well, partner, depending on what percentage that you're going to bring them in at, can be very expensive. True, you have, you know, another colleague or another person that can cover for you to kind of expand the access to add, you know, hours to access. But again, it can be very expensive. Higher mid-level providers. Well, in Florida, we certainly aren't allowed to have those. I think maybe Ohio, maybe New Mexico, possibly. I mean, I know Alaska, but not. It's not everywhere. So that's not always a great option. You can join an existing practice where you've got an established dentist who's ready to kind of like, you know, retire the shingle, hang it up, which is great. You know, there's mentorship there to be gained, and inherit someone else's problems. I think that's probably inevitable. because again, if he's been doing or she has been doing the practice for 30 years, they're bound to come back and say what's going on. My experience though with that is again from friends that have bought practices from other retiring dentists, that when the old dentist leaves, a lot of times a good portion of the new patients also leave. They're not always comfortable with the new guy. They always find some reason why, well, that person doesn't really know my style or doesn't like, they seem nice, but they could be my grandkid. I hear that a lot too. Not you shouldn't do it, but again, it happens. So then what else could you do? You could join a dental service organization, supported practice, and with plans for ownership, kind of like I did. Now, the ownership piece for me at that time was well advertised. They said, you're coming into the company kind of at a new time when they had just gotten into the Florida market. Ownership is a real chance. It's definitely a real chance for a lot of states that are still out there. And I think ownership with even other dental service organizations is definitely possible. So we're talking about the new model of dentistry, the DSO-supported practice. What does it do? Well, a lot of things. We expand the access to quality and affordable care. We're able to leverage our size with companies like Henry Schein. We get better deals on materials. We're able to, if we have 5 offices in the area, we're able to advertise for the same type of brand of dentistry, but split it between the 5 offices. So advertising becomes cheaper when it's spread out like that. You balance the availability of dentists and the patient populations. A lot of these dental service organizations practices, they have multiple dentists in there, so time off is not very difficult, especially when compared to the traditional model where, literally if you were the dentist and you were the only one there, the whole practice had to close down if you wanted to go on a vacation. That does no longer have to happen. These companies are they love cutting edge technology. They get better prices on things like milling units and scanning machines and implants. So again, it becomes a little bit more affordable to do the dentistry, and then we can also pass that cost and savings on to the patient, where ultimately, let's say, I'm just going to use a general figure, if it's $2,000 for an implant down the road, it may be $1,200 at your office, because again, the cost to do the business is a little bit cheaper. I think we got one more slide like this. There we go. Okay, good. Oops, let's go back one, Rich. I think one of the important things to talk about here is, though, I kind of mentioned it. You can share supervision among multiple practitioners. It's great too, especially if you've got, maybe a mentor-mentee type of situation. Older doctors there, seeing a few things, maybe something you're not quite sure what's going on. You could just grab them, bring them in. It can really improve your skills as a new dentist, which I know it really did for me. And again, I think the most important part is, especially when you talk about dental service organizations, is that they take the business of dentistry off of your plate or off of your table and let you do what you do best, which is take care of people. There are certainly ownership opportunities, like I said, and you'll get a little bit more into the business side of that. But when it comes to just strictly taking care of people or honing your skills or getting up your speed, there are a lot of things that you will not have to think about when you do join a dental service organization. Staffing is not an issue. If there's some kind of problem with let's say, a dental assistant, you're not doing any firing. You go and tell somebody that's the office manager or somebody who has the authority over those people, and they will handle it. I mean, it becomes very nice to just focus on the patient, focus on doing quality work, and making people happy, ultimately. Let me just check my notes here. And I guess it gets back to, okay, well, I know the stigma is, well, you got big business kind of running things. They're making all the decisions. They're deciding what materials you're going to buy. They're deciding what materials that you use. And as far as I know, if that is happening, it is illegal, and you should either get out of that situation or report it. But my experience, and I can look at you dead in the eye and just tell you that our clinical decisions are at the sole discretion of the doctors. We choose what materials we want. We choose what implants we want. We, however a patient is going to be treated is up to us as the provider. There is no influence from a business standpoint. Now, what I can say is kind of like good in the partnership is that I don't have to decide, what color the interior of the office is. They pay people thousands of dollars to figure out that, okay, well, this color calms people down or makes people less anxious. Okay, great, paint it. They decide what marketing or what advertising channels we're going to use, who we're going to go to. Okay, well, we're on at this time of day. We found that it's not really working at this time of day. You don't have to worry about that. They're doing all those hard, decisions for you, which again makes it very good. There are a group of professionals that are making business decisions to help support you as the doctor to take care of people. And I guess that's the best way to put it. So here we go, strength in numbers. What we're finding again too is, in a lot of these dental service organizations, they're technically group practices, meaning that you don't just have a general dentist and a hygienist, doing general dentistry and hygiene. What we have is, I know especially in my office, I had an endodontist. I liked having an endodontist. It's very nice. We have an oral surgeon who's fantastic, but they'll kind of like circulate through the area and hit the office once or twice or 3 times a month. But the important thing I'm trying to bring up now is that, the group practice model is becoming important because patients, they don't want to be referred out. They don't want to go someplace else. They've gotten the courage up to come into the office, which a lot of times is the hardest thing for them. It may have been 10, 15, 20 years since they've seen a dentist. They made it in, and now they need 3 root canals. And now we got to tell them, okay, we have to go see this other doctor and then see how that goes. Maybe you can afford it, maybe you can't, and then come back to us if everything goes great over there. And they just don't like that. They want to be able to sit down and you can say, okay, well, your root canal is going to be done by Dr. So-and-so on this day. Right afterward, we're going to prep it for the crown, and you'll be all done within a week or so. So again, people like to stay in one place, and again, it makes it predictable for them, especially if you have the convenient hours and payment plans and things like that. So here we are, we're at a critical moment in dentistry, and it's not time for complacency. We can read the rest of the quote there. But I guess what we're trying to get to is that, it's not really time to just sit back. It's time to lean in, lean forward, go all in, and just become an active participant in your future. You want to ask smart questions. You want to understand your options that you've got for your career path. This is why I think the next EDS has been so great. We didn't have this tool when I was coming out of dental school. A lot of times, folks, they don't have, a business management or dental practice management course. I know we did in my senior year, but it really was just about, how are you going to get a job out of dental school? It had told you nothing about insurances, nothing about consumerism, nothing about online reviews. It was just, here's what you need to ask when you go to your job interview, and here's what you need to look for. But we're going to talk about that as well. But I think this is a great, powerful tool for dental students especially to kind of get exposed to the way the world works and how business is affecting dentistry and how consumers are affecting dentistry as well. So again, you seek as much information as you can and make educated decisions for yourself. What this is an important question to ask for any practice opportunity you're considering. How many patients does a practice see? There's a good point I'm going to bring up here in just a minute. And are they new or returning patients? There's a couple of models that I've seen. You have dental practices that are based off of hygiene. All of their procedures or any kind of production, if you will, that the dentist or the practice is expecting to get is derived out of hygiene. So maybe those practices have 3 or 4 hygienists, and they're seeing, gosh, hundreds of people for hygiene a week. The other, and that's fine. You're going to be busy that way for sure. But then you have other like dental service organizations that are like Aspen Dental, where we're really looking just for new patients. Hygiene is something that gets done, but again, we have such an influx of new patients every single day because of the way we market, and the net, I guess, is cast wide. That's where we're really focused on, the production coming from. What does a typical schedule look like? Are they seeing like literally one patient every hour, doing 3 hygiene checks, and maybe you see 1 or 2 new patients a day? That is the very typical model of a private practice right now. My philosophy is, and why, I had a job with a private practice that a lot of folks would say, that was a good job to get. High-end aesthetic place, a bunch of operatories. They had kind of a group practice model going on there, but I was not promised any amount of new patients to see each day, and I was not promised any production that I would get on each day either. And a lot of times those models, you may have heard of this, you kind of eat what you kill. If you're not producing anything, you're not getting any collections, you're not making any percentage of anything, so sometimes you just don't make any money that day, which is not good. It's important to make money as well. But again, the schedule, when a lot of dental service organizations schedules, you'll see they are packed to the gills. In a typical day, I'll see between 40 and 50 patients, and that's between denture adjustments and production and new patients. But what I realized at the time, when I had kind of like the best of both worlds presented before me, I thought, okay, well, if I go into the private practice model and I'm seeing just a couple people a day, I know I'm not going to build my speed that way, and I may get used to the way that feels. And it will be harder, let's say that didn't work out, to try to join the dental service organization and not have the speed to jump into it, versus going to the DSO and seeing 40 patients a day. Again, it was a difficult transition at first, but I think it's easier to go from being busy to not being busy than vice versa. I think you may end up pulling your hair out if you're in a private practice and all of a sudden you're in a DSO. You may find out that I can't do this either. This is not, I don't know where I fit. But that was one of the deciding factors too why I chose the dental service organization. Here we go. What types of procedures and care is the practice giving? If they're doing full mouth reconstructions, great. Probably though the main dentist is going to be the one that wants to do those, because again, those are high dollar, high value type of procedures. You may be getting the crowns and the filling. Again, it's fine. You'll get exposure to that if that's really where you want to go. But I know dental service organizations, a lot of them have exposure and CE courses that you can take that a lot of times are free on that end. They'll take care of you in that way. So what is your opportunity for professional growth and/or practice ownership? And for me, that was the really key, because I think everybody wants to own their own practice at some point. This is definitely different than a traditional office or a traditional practice. But again, like I said, I don't have to make a lot of those decisions like, okay, who are we going to market to? Which way are we going to go? Are we going to pay for the Google advertising or not? I don't worry about any of that stuff. I know that there are people that are paid a lot of money to make those decisions, and they're very smart, and they're very savvy, and the growth is proof positive of that. So again, the best thing you could do is just figure out if the practice is going to be right for you. I know mine was right for me. I wish you guys all the best luck. So here we are. We're at the end of the presentation. It looks like we're making good time. The evolution of healthcare is upon us, guys. Patient demand for value and convenience continues to affect healthcare providers. Medicine, optical, pharma have all undergone consolidation, and dentistry is facing the same probably mechanism. So we got, the dental service organization is increasing in importance, and just ask yourself, where do you think you want to fall into place? I think we're going to have a discussion now.
Exactly. Thank you so much, Dr. Gillan. We really appreciate your perspective. Thanks, everyone, for taking part in the conversation. as those questions come in, I have just a couple that have come in on the side, Jere. If you want to start with this one while those do. How did you go from associate to a practice owner so quickly? Is that a typical path, or can you explain how you started that whole process and got on that track?
Right. So as I got to the office the first day, a lot of it was, you know, ownership is out there. There may be a couple of milestones to hit as far as you know, office revenue is concerned. But I know, especially with Aspen Dental, is they're not so concerned about the numbers. They're looking for somebody who is aligned with the same interests as the company, because the company has a very distinct vision and mission, what they're trying to accomplish. And when they find somebody kind of like myself at the time, it became a great fit. I liked what they were doing, they liked what I was doing, and so I think the speed of it all, you know, the CEO, Bob Fontana, he likes to describe it as you date for a little while, and then you get engaged, and then you get married. And it was, for me and Aspen Dental especially, it was very hot and heavy for the first 6 months. So we got married, and it's been a great marriage ever since. But again, it just depends on how you are, how you view what you're doing. You know, was everything perfect and awesome the whole time? No, there were things that I had to do. You know, maybe trying to fix somebody else's problem that I wasn't going to get any credit for, any compensation for. And I'm just using that as an example. But you know, some of those things you have to just have to look past. You need a longer view of your career and what it really means to make something of it.
We have a question that also arrived in just moments ago. What would you recommend when preparing an interview with Aspen Dental specifically?
Be confident. Get familiar with the model. You know, and definitely be yourself. If you know, one of the most important things I can tell you is, during the interview, while I was, you know, nervous ball of nerves, I still just kind of, I knew that this was a good company and I wanted to be with them, and I was just myself. And when I was myself, you know, the hiring person at the time, you know, just picked up on it and she liked it. So, you know, it worked out.
A lot of the conversation, if you're thinking about a DSO-supported practice, comes down to maybe a culture in which you fit. There's certain ways that you would recommend our new graduates to think about how to identify and feel out that culture so they get an understanding.
Yeah, I mean, I think if you're at an interview, ask to see what maybe a schedule would look like, because I know. If your idea is not to see a lot of people or to try to get maybe a root canal and a crown prep done in an hour, and you know you don't have that speed or don't really feel comfortable at that point, see if the office schedule is set up beyond your scope or your expectations. I think that would be a good idea. The other thing I know is, you know, anybody comes in to do an interview with me, I will kind of give them to the dental assistants and let them talk to the dental assistants and let the dental assistants feel them out as well. And it becomes a neat thing because I get good feedback for how the person or the doctor that I'm trying to interview really was. So if you're trying to figure out a culture of an office, you're not always going to get it just from the doctor, because a lot of times the doctor is, you know, maybe they're just excited because they're having a good day or whatever. You know, talk to the dental assistants, talk to the hygienist. They pull you aside and they're like, run out of here as fast as you can. Then obviously, you know, that culture is not good.
Fair enough. Well, originally when we conceived of this series, we were thinking about those students who are soon to be graduating, but we have some questions from even students that are maybe looking down at least another year of their dental school training. At what time should they start thinking about exploring one avenue, one pathway into the profession, whether it be a dental support organization option or federal dentistry or even private practice? At what time should they be thinking about that decision?
That's a great question. I'll say it like this. If I could have interviewed probably in my junior year with maybe a Heartland Dental. I didn't. I interviewed in the senior year. I think that I don't think there's any time limit. You know how you are in school. You're in your junior year, let's say. You know things are going well. You're going to pass board. You're going to pass dental school basically. Start to put the feelers out. The more faces you get in front of as far as recruiters go, the more they'll remember you, and I think, and you'll have time to really explore and find that perfect opportunity for you.
You also spoke about mentorship during the course of the dialogue. What was your experience with mentorship when you first joined the practice, and do you serve in that similar role now? How do you see that being something our dental students should think about?
Yeah. Most dental service organizations offices, if they're established, and most of them already have been. Well, let me back up. I wouldn't start your job, your first day on the first job at a brand new office with a dental service organization with another guy or girl who's right out of school. Not going to be the best fit, and sometimes you're not going to really learn that much, or maybe fumble through it like yourself. My experience was we had two doctors that worked basically on call 24/7. President of Clinical Support Arwinder Judge and Vice President of Clinical Support at the time, Scott Dickinson, and these guys were just 20, 25-year veterans themselves. Anything that has happened, good or bad, has happened to them. So again, they made themselves available to me, and before we even met, I had probably spoken to them a couple dozen times. But that's what I mean. You put a call into them at that time, and they were right there. But now my doctors, they can call me because now everything good or bad has happened to me for sure. So any issues that are going on, I'm their point of contact. If there's something that I'm not sure about, I've developed relationships with other specialists, let's say, and I can quickly call one of them and say, okay, here's the situation. What should I do here? But again, a lot of the dental service organizations do CE courses 3 times a year. Sometimes they're 4-hour courses. Sometimes you get to kind of make recommendations for what you'd like to see, and then they'll basically call Dentsply or call Nobel Biocare or whatever it is, and that will put on a full-blown CE course for you.
Really interesting. And I have a question that I think is really driving in this direction. When it comes to a 5-star practice and you were thinking about the ratings, is there something that you do as someone who's focused on the clinical side of the affairs? How does that translate from the marketing side? How do you see that crossover to get to that type of patient satisfaction?
Okay, here's a great metric that we use. It's called the well, I'm not going to tell you what it's called, but what it is the would you refer us to your friends and family metric, okay? Patient loyalty is the technical name. But what we found is that who we really need to get to are the people that are undecided. There will be people that love you no matter what you do. There will be people that hate you no matter what you do. But there's a good chunk in the middle that they're just kind of indifferent. Yeah, I was at the dental office. Yeah, I don't know. Yeah, they had TVs in the chairs. Yeah, I watched the news for a little while, and then they just leave. But what we find is that if you say that one extra thank you, or you just apologize for their wait, or just the small little things that may get somebody's attention will help sway them in that other way to where they're going to say, well, that was a good experience. So that's kind of what, as a clinical provider, it really just centers around customer service. Everybody's heard the thing, treat somebody like you would treat your mother, and it really rings true because if you're going to go above and beyond for anybody, it's going to be your mom. But when you do that for the patient, a lot of times they sense it, and it can change somebody's mind, basically.
Makes perfect sense. Is there a specific type of new grad that is making this transition in the near term that you think is particularly well suited for a practice environment like yours? I'm sure that there's some things that you saw out of former classmates that you said, hey, this person is good for the following, or maybe in hindsight you do now. What's that little nugget that you see that you wish you knew when you were in our attendees' shoes?
Well, I think to answer the first part of your question, what the best fit for somebody who's going to go into a dental service organization is somebody who's not good with the status quo. They understand that maybe working until 7 o'clock at night is important, and also, you know, ownership, mobility, upward mobility, things like that. You want to progress through your career, and if right now you're thinking, okay, well, maybe I can't say that, because dental service organizations, a lot of times they can fit a lot of different personalities. If you're the associate that just wants to learn how to do better fillings and cut better crown preps and take your time to learn to do that, I can tell you there's probably a spot for you. But then there's also, on the flip side of the coin, you're aggressive, you're confident, you need to make a living, you need to make a career something, there's probably a spot for you as well. So again, we cast the net wide for the patients, we can cast the net wide too for doctors.
Interesting point. Interesting point. All right, well, I think those are the last of the questions that we have coming in, Dr. Gillan. Folks, if you do have some additional questions, certainly for the next CDS, we'd welcome the chance to field them. And as you can imagine, our speaker for this evening was very gracious with his time and making himself available, and I'm sure he'd help give some of that its due if you wanted to pose accordingly. But let me do this, everyone. Thanks so much for your attention tonight, and for Dr. Jere Gillan for giving us such a great presentation. Really loved it.
Thank you, Rich. I appreciate you guys very much. Good luck to all the dental students out there. You know, it's a fantastic career, fantastic experience. You've done well so far.
All right. And thanks also to our sponsor for this evening, Aspen Dental,